Hello, everyone. I just wanted to give a quick update. We're going to cancel the formal meeting for August. We had a lot of busyness with Beaker in July, and there's less topics for the agenda, so I just wanted to give you guys the gift of time. I'm going to send this quick video message as kind of a highlight if any of you are interested in watching this content as a video overview rather than reading through it yourself. I'm not going to read through everything, so if you want the full details, please do read through it yourself. But if you're interested in having this read to you or highlighted in this format, this is for you. So briefly here are updates for this week and this month. Canceling the meeting as described. Our COVID numbers have drifted up a little bit. We're at 17 inpatient, 0 on the vent. The nursing shift report is included, which we will go over. I wanted to remind people about cardiology because we've had some people that have struggled trying to find the bolus of heparin. You may recall that most of the time we shouldn't need to give heparin, but do ask the cardiologist, and if by chance one of them wants you to give the heparin in the emergency department as opposed to waiting for the patient to get it in the cath lab, the only place you're going to be able to successfully find the heparin IV bolus one-time only dose is in the emergency medicine chest pain order set. If you try to find it anywhere else, it will cause great anguish because it'll be in a bolus from a bag of infusion and it just won't work. So just remember, that's the only place to find the one-time bolus is the emergency medicine chest pain order set. We're going to go over some Beaker changes here in a moment. Basically, I'll go over all this stuff in the next slides. The nurse report is here. Nurses are working very hard to try to make sure we do a better job of capturing the ECGs in triage, which has been a bit of an ongoing issue for us. Some Cepacol lozenges, which doesn't matter to us. You should be aware from previous updates that third trimester pregnant patients with back pain, lower abdominal pain, or vaginal bleeding should be considered a level 1 trauma activation. Monkeypox kits are in the hallway to nowhere. Ask the charge nurse, and please do access the job aid on ordering monkeypox from our SharePoint website in the infection control, infectious disease library there. Most of this other stuff is for nursing. Skip past that. All right, there is a case conference coming up with the subject of serotonin syndrome. It's going to be on Wednesday, August 10th at 1 p.m. in WEGI 123. So hopefully we'll see you there. Brief Beaker updates. You guys have gotten a lot of info on Beaker, so this is really a summary, nothing new here. The add-on process for non-blood samples, basically you have to type in the comment section specimen in lab, and then you have to tell the nurse that they can use the specimen in lab, and the nurse will call the lab. This rainbow, I would encourage people to use this. The nurses will use it sometimes when they're triaging, but we can use it also if, for instance, we want to include like a light blue tube in our chest pain favorites in case we need to add coags. That might be a good idea. Or if you think you might at some point later in the ED course need to add on a specimen, you can do that with the add-on. And I would encourage all of our APPs, if they're working PIT, to add on a specific rainbow draw, like again, like a chest pain. Maybe don't order the D-dimer, but do the rainbow draw so that if we want to order it, the tube's already there in lab. The troponin, you should be using change it to now and then every 1 hour times 2 occurrences. That's the best way to get your now and 1 hour troponin. POCT, ABG, or venous blood gas will get you the super gas. That's the best way to order that now. Don't forget about the safety response team. The nurses are getting a lot of education on this. They actually do a pretty good job. So there's the PRT, the psych resource team, and then the safety response team, which is kind of a higher level when things are really more imminent. And this brings not only the PRT team, but also security for security events. All right, just very briefly, I did actually have a reflection, which I forgot to do at the beginning, but we'll do it now. Quality is not an act, it is a habit, from the famous philosopher Aristotle. ED volumes number, if you want to get into the weeds on that. Daily census for July, 164, 163 in June, 162 in May. So fairly stable, only slightly higher. Left without being seen, crept up just barely 4%. We've been hovering in that 3 to 4%. And if you look at these numbers, they've been fairly stable from month to month. We have more work to do here, but at least we're maintaining our own despite slightly rising volumes. We're about 16 minutes getting patients from the door to a room, and then an additional 9 minutes before they're seen by a provider. So we're doing much better than at the thick of the surge with that. This is something we've actually had for more than a year, but we've used it a couple times. So just a quick reminder that we do have thrombectomy capability now for non-stroke, specifically large PEs and DVTs. If you think you have a candidate, call interventional radiology. Diol just took some huge clots out of someone's leg, and just recently out of someone's lungs for bilateral sagittal emboli. So don't forget about that resource. Briefly, just to show the latest patient experience numbers, we've had some improving trends lately. So I wanted to show these numbers to you, let you kind of get into the weeds on them on your own. This is the main emergency department. You can see a slight upward trend there here with the last couple months. And we had a really great month of May. So that was spectacular. And then Southwest upward trends as well. So congratulations on that. Keep up the good work. I'm not going to read all of these just out of the sake of time, but please read through these. There's some really great comments here. Some excellent comments. Dr. English was mentioned specifically, informed about delays. Mark Vergursky was mentioned specifically. Kind, courteous, efficient, just some great comments. And then downtown as well. There's some nice stuff in here about equity and about and how impressed patients were with the way we dealt with like homeless and alcoholic people, focusing on equity. Some real nice stuff here. And then the last part of this update is the Kent County EMS Roundup, which is really targeted for EMS, but there's some good stuff in there if you're interested in reading through that as well. I'm not going to go over that. I'm just going to kind of quickly scroll through it. And that's about it. As always, my door, my email, my phone, my haiku is always available. Have a great day, and we'll chat later.